Mhm.
Welcome to another episode of MedTalks with Catherine. Today I invited Angelo de Oliveira into the MedTalk. He has been a loyal MedTalks listener. Today he's in the spotlight, and we are going to talk about his journey about type 1 diabetes. Hi, Angelo. Nice to meet you here, finally as a guest.
Hi, Catherine. I thank you very much for inviting me to be here with you. It's really a pleasure to be here. After watching so many MedTalks with you, so thanks for the invite. Really.
Yeah, great. Thank you for being here. Why don't we start? Maybe you tell our listeners a bit more about yourself. Where do you live? Since when do you have your diagnosis? Just some short summary of your life.
Sure. Well, I am originally from Rio de Janeiro, here in Brazil, but I've been living in São Paulo for the past 11 years now. I live in a smaller town called Atibaia, which is like 1 hour away from the capital city, São Paulo. Um, and I am a medical translator.
Translator, right? Yes.
Sorry?
But you haven't always been working as a medical translator, right? You've done something before.
No. Actually, I come from the educational area. I was a language teacher for 30 years until I became a translator. And only more recently, for the past year and a half, is that I've been focusing on the medical area.
And what made you change that?
Actually, it was a volunteer work that I did. Actually, I still do with Wiki Project Med, which is a medicine project for Wikipedia, for taking medical information to everyone in every country. And then I started becoming interested in the subject area. And that's how my path began with medical translation.
Right, wonderful. I mean, it fits you well, I think, I would say. I only know you as a medical translator, and I think it suits you well. So let's get back to the actual topic today. It's your diabetes type 1. You just told me that you don't have it since you were born. So tell us more about that. When did you diagnose? Did you get diagnosed, and how did that happen? Like, how did you feel when that happened?
Sure. I was diagnosed when I was 14 years old. I was turning 14. I remember that up until then, I had a little, I was a little plump. I had a little obesity factor there.
All right.
And suddenly I started losing weight, a lot of weight. So at first we connected it to me becoming a teenager. But then I started just peeing a lot and feeling very, very thirsty.
Mm-hmm.
It came to the point where I peed on my bed, being 13, almost 14. So that's when, the alarm rang.
Yeah.
And my parents realized that something was wrong. And then they took me to the doctor to see what was going on. And then we discovered that my glucose level was like 289.
Wow.
Yeah. And then they told us that I was type 1. I had type 1 diabetes, which came as a shock.
Yeah, of course, of course. How long did it take your parents, like when you said you started, your first symptoms, you started to lose weight until you went to the doctor? How many months are we talking about, or weeks?
We
Until
are
the
probably
beginning,
talking about the whole process was probably about 6 months.
6 months.
Yeah,
Um,
because I remember that, I mean, losing weight, I mean, was a longer process.
yeah,
And then when it came to peeing a lot and being very thirsty was like by the end of this process. And that's
yeah,
when things got like, well, what is going on? Yeah, because up until then, we just thought that it was probably related to my turning, you know,
right.
adolescent.
Yeah, yeah, right. Um, the doctors told you straight away that you have type 1 diabetes, or did they do any diagnostics, any tests?
Yeah, think of it like that was back in 1984. So
Okay, that's a bit.
yeah, the diagnosis was much more precarious, I would say, in terms of what they had at hand to offer in terms of diagnosis. So immediately when they saw that the glucose level was 289 and that I was 14, it was immediately connected to type 1 diabetes.
Right.
Um, so we didn't have at the time the test that we have nowadays, the genetic test that we have nowadays. Yeah.
Right.
So
Yeah. Very interesting. So they just saw your symptoms and your glucose level, and then made a diagnosis based on that. Yeah.
basically, yes.
All right. How did it go from there? Oh yeah, I have another very important question. Do you remember how much you drank at that time before you went to the doctors? Because you hear crazy stories of people drinking like 10 liters of water every day, which is also the cause why you pee so much, obviously.
Yeah, yeah.
Yeah,
Well, it didn't come to that, but I can't say the exact amount, but I know that it was a lot.
yeah.
It was a lot, but not like 10 liters, I would say, I
Mommy.
think. But it was a lot because the thirst becomes like something unbearable. It's like very strange, you know, the feeling of so much thirst like all the time.
Yeah, right.
Uh,
How was your diet back then? Were you like, I mean, 84 people weren't really aware of healthy food, I guess. But how is it in Brazil? How do you think your nutrition was?
yeah. I mean, at the time, I would say that here in Brazil, we had, first of all, our diet here at the time tended to be healthier than nowadays because we were, I guess, very isolated from the world. So not many things would come into the market, industrialized things,
Yeah.
sweets, and all this stuff. I remember that we had like, hi, Annabella. I remember that we had like maybe three different kinds of candies that, you know, in the country that
Yeah,
were very
interesting. Yeah.
famous.
Yeah, right.
It was not that much. So as we didn't have access to all these, our meals tended to be much healthier than today, actually. And my mother, uh, she was always very concerned about food.
Very
Yeah,
interesting. Yeah, yeah.
yeah. Even without knowing all of this that we know today, you know, about carbohydrates and
Yeah.
calories and sweets and stuff like that. Our diet at home was always something like she cared very much about vegetables and fruits and legumes. So it was very balanced.
But that's a very interesting point, isn't it? These days we talk so much about nutrition and diet, but almost nobody does it right because it is very hard to not go to the grocery store and buy the yummy stuff and the quick stuff, you know. Especially for the kids, it's so hard for them to not choose sweets.
Yes.
Yeah, how to what yeah, I don't know, to what extent do you make the the how do I put it, the nutrition industry responsible for those kinds of diseases these days. What would you say to that?
Yeah, we've come to this point. Yeah.
Much further than I thought.
Yeah. Here in Brazil, we tend to, well, I've been seeing a lot of that because we have this cook on TV. Her name is Rita Lobo, and she talks a lot about that. And she's connected to the academic area as well here at USP in São Paulo, and even to the government. She's responsible for our food guide for Brazilians. And she's been talking about, it seems that they here at USP, at the University of São Paulo, they created this term that we have everywhere nowadays, which is the, how do we call them? Like this over-industrialized products that we have.
Yeah.
And they're very concerned about it. So it is a discussion. However,
it's good to know. Yeah. However, there is an however. Sorry.
Yeah. However, I mean, as a people, we've been turning our back to that and just absorbing everything that the industry bring.
Yeah.
So
it's wonderfully easy, right?
It is.
Yeah.
It is, and it's about the style of life that we have. Yeah, the faster style of life, work, and all. And we haven't been really concerned about all that. And we've been talking about food in a very strange way as well.
True.
In a very functional way all the time. To eat my carbs, to eat my proteins, to eat my calories. No, you're eating food. I'm sorry.
Yeah, that's very true.
And food is much more than that. Because there is like a personal connection, a sentimental connection, a social connection to food. It's not only functional.
Yeah, definitely. That's a good point you're making here. Let me go back to the childhood. I turned around the wrong corner before. So you got the diagnosis when you was, Annabella, for you just to recall that, when you was 14, you got the diagnosis of type 1 diabetes, and that only based on symptoms and a high blood sugar, because in 84 there was not a lot of diagnostic measurements. So we are back in that time. What did your parents think about that? Obviously, your mom was a very a conscious person about food and probably health in general. What did she make out of this?
The feeling that I recollect from those times was of a little desperation, actually. Everybody was like trying to understand, to figure out what was happening, but it's normal,
Obviously.
Because it's a chronic disease. So we knew that it would be for the rest of the life. And at first, the doctors, at that time at least, they were throwing information at us, and not really good information. Like, if you don't do this, you may lose your legs. And if you don't this, you may lose your sight. And it was like, for a 14-year-old boy, it was like,
okay, thanks.
Oh my.
Yeah. Oh, I hate
everybody in the family. But it was good for me as looking back. I know today that it was good for me as a person to have been confronted with that when I was 14.
Why do you think so?
Because we realize that you cannot go it alone. You really, and we all do, we know that as human beings, we depend on each other. Right. But it's very nice at such a young age for you to realize that for me to survive, I need others. I need people. So at the time, I needed my family. I wouldn't have made it without them.
Yeah.
My whole family at home, my mother, my father, my brother, they uh, they embarked with me on this journey, and they decided everybody was on the same diet at home. So my mother wouldn't cook
Wow.
different foods for me or and for them. It was like everybody was on the same diet.
Oh, that is really cool.
Yeah, she she wouldn't cook sweets. At the time, we didn't have even Diet Coke here in Brazil.
Yeah.
The
Perfect.
only possibility for a sweet was like we had, I guess, Diet Jello, and that was it.
Well, we know also when it comes to cancer that sugar is like the death anyway. So probably, I mean, as a kid, it must be hard to not have like what everybody else has. But what changes did you guys make? Like when you say your mother cooked differently, what were the most prominent changes you have in mind?
Uh, Once again, in terms of food, it was not that much. Uh,
Yeah.
but concerning the quantity of food, maybe yes, because there was a restricted amount that I could eat, and I would have to substitute things if I wanted to. Instead of rice and beans, I would eat like a certain portion of potatoes,
Yeah.
you
Yeah.
know, or a little bit of pasta. So we needed to know how to do that
Yeah.
because there was a fixed meal plan
Mm-hmm.
and for a fixed amount of insulin that I could
All
take.
right. Yeah.
Nowadays, it's not like that anymore because we have what we call carbohydrate counting. So I
Mm-hmm.
know how to count the carbohydrates in my food, and then I see how much insulin I need for that. So
Right.
there
So
is no
back in the
problems
days
in
you were,
eating.
sorry, just to clarify that, back in the days you were told you have to inject this and this amount of insulin, and then you eat to that. And these days it's the other way around.
Yes,
Yeah. So how was that when you were young? I guess 80, what was it, 4 or 5? There was no
84.
automated injection system. How can I imagine? Did you have like the syringe and the needle? Did you have to put that all? Yeah. All right.
Yes,
Tell us about it,
yes.
please. It must have, and also how it felt as a teenager to be so dependent on this, and also to be, I don't know, doing this in public in school or something like that. Yeah.
Yeah, there was this kind of social aspect of things as well. Yeah. I remember that a nurse taught me how to uh, give myself insulin injections. It was not a big deal. It has never been a big deal injecting insulin. Sorry.
No worries.
But yes, there was a social issue about that. So at the time, I remember that as a teenager, I didn't feel comfortable injecting insulin in front of others. So I would normally go to the bathroom or to the
Hmm.
toilet to do that, kind of hiding myself
Yeah.
sometimes.
Yeah. Yeah. It sounds like.
Until I got to the point that I was injecting insulin on the bus or wherever I
Okay.
was. Yeah,
Interesting.
so I needed it, so let's
Yeah.
go, let's go.
Yeah.
You know,
Did
so
you
you
have
get to this
to
point.
measure your blood sugar before that, or was that all out of scope? Was it just the insulin injections?
No, there was what we now have as a sensor. I use a sensor now for my to track my glucose levels. At the time, it was even before the glucose meters. You know, the for you to do your
Yeah.
capillary
Yeah.
uh, uh, testing.
Yeah.
It was before that. So what we had was, don't laugh, but what we had
Right.
was um, this sort of a little test tube where you had to pee inside, and there was a little
I
pill. that you would put in your urine, and there would be a chemical reaction with a color. So according to the color, like blue, your glucose level would be between 80 and 100. If it was yellow, it would be between 100 and 140. If it was orange, 140 to 180. If it was red, it was like a despair. But it was like, the range was very large there.
Yeah,
So
yeah,
you never knew precisely what was happening.
Wow, so this was like a real beginning. I mean, it sounds
Yes,
kind
a
of
real
cool
beginning.
too. I like that kind of experimental stuff. But I mean, if you have how many times a day did you pee in the pipe thingy?
Actually, I had to do it before every meal.
Yeah, right. Well, that sounds like quite a hassle. And what if you can't pee at that time? Then you need to wait until you can pee.
Yeah.
Wow. Okay. Wow. This sounds
somewhere where you can pee.
what a difference to today, right? Brings
What
us
is
to the clinical trials, why they are so essential, right? To get exactly where we are now. But before we go there, did you experience any bullying from your classmates, schoolmates, when you were like a teenager for this, or were they all cool about it?
No, bullying for having diabetes, not really. It was more personal, So the burden that we have with diabetes, which nowadays is called diabetes distress, there is a lot of mental, psychological, emotional things going on about it. At the time, I never knew it, but nowadays I do know that it brings anxiety and the mental overload, information overload, because you're dealing with a disease that can bring you to death in one single thing that you do not control correctly. So it's a life or death. You have to deal with life and death decisions 24/7. So the mental overload of that is too high.
Especially for a teenager, right?
Especially for a teenager, yes.
Yeah.
So I spent like 2 years until I was 16 trying to deny it and not caring about it. I was in denial for 2 years until I remember quite vividly, until one day my mother kneeled beside me, crying, and said, "We've been doing all that we can. Now it's on you.
Right.
You have to remember to take your insulin. You have to remember to do the things that you need to do." And that's when something clicked on me.
Yeah.
And I was like, okay, yes, that's it.
So when you say you were in denial, that means you weren't looking after yourself and you weren't taking the insulin, or how can we imagine that?
Yeah, I was pretending it didn't exist. So I forgot to take insulin. I got sweets and ate.
Oh, right.
And, so I was like, just living like it didn't.
Yeah, it didn't occur.
It hadn't happened at all.
But did you feel that then? I mean, when you're over sugared and when you don't put a lot, like if you don't help your body to lower your sugar levels, you get your symptoms back. Wasn't that something that kind of turned you off or turned you on to give it more attention? How did you experience that?
Yeah, I was worried, of course, but I guess I was not mature enough to get over that. And we didn't at the time have any kind of psychological support to help us through, and looking backwards, I know that I needed it.
Yeah.
I needed some psychological support. My parents were not able to give me the proper, because they were not professionals, so they were doing what they could, and I was also doing what I could, without any professional support in that matter.
Yeah, in such a sensitive life phase also, and listening to your parents as a teenager just sucks. They don't want to do that. So I have 3 at home, so I know all about it. I understand that completely. And then you're also so busy with yourself, with your world, finding yourself. Who am I? What am I going to do with my life and all this stuff? So being in this, like 14 years old, getting this diagnosis, I can just imagine how bad that must have been, like to find yourself in that role, but also for your parents. Your brother, was he older or younger than you?
He's older. He's 4 years older.
He's 4. Did he have any role in this, or were you kind of not talking about all this diabetes stuff?
No, not really. He was supportive, like my parents. But at the time, he was 18, so
Yeah.
he was worrying about a lot of stuff as well,
Yeah.
going to university and working, and so it was a more turbulent time for him as well,
Right. One question I forgot to ask you before was, when they say you have type 1 diabetes, that usually means that your pancreas is not working at all, right? There must have been a cause that it was working for like 13 years and then it just stopped working. Do you have any idea what caused this damage of your pancreas?
Yes, type 1 diabetes is an autoimmune disease, a chronic autoimmune genetic disease. So there's some break in your DNA that provokes that. And it tends to come up at certain points of your life. So it could be when you're born, from then on,
Yeah.
and some things that may trigger it to come up. Becoming a teenager, for example, when your hormones start going wild, is a trigger.
Interesting. Yeah.
Yeah. So, but we know nowadays that type 1 diabetes can come over even when you're older.
Yeah, I heard
Or
that
old.
just a few years ago that this is like in the past that every adult who was having diabetes was directly type 2 diabetes, but a lot changed in that perception, and also it gets more and more finer and finer diagnostics. So yeah, what do you know about that?
You may even have type 1 and type 2 diabetes, because type 2 diabetes is connected to your normally, it's connected to your style of life, to the way you've been living, eating, exercising, and all. So all that counts for type 2 diabetes. We are often patients with type 1 diabetes is often treated as if they had type 2 diabetes. So whenever I am eating whatever I want, because I can eat sugar, sweets, whatever, because I know how much insulin I have to take for that. Whenever I'm eating, there will be a family member like, "You're diabetic.
Yeah.
You can't eat this." And
Yeah,
then
well,
you have to stop patiently and explain, "No, I can. I know that I can. I took my insulin. It's all right."
Yeah, I understand that though. If you don't have an idea about it, I understand that. Why can you eat sugar when you're diabetic? I mean, this is what you're told all the time, right? Yeah. Before we go to your life today, I would like to know, you said that in the beginning that the way the doctors told you when you were 14, the communication wasn't really nice. It wasn't really clear or like teenager friendly. But through your journey around like your life, How do you think that it developed, or how did you like? I don't know. How did you feel about that?
Yeah. Um, I've I've been through all kinds of stuff, you know. The doctors at the time, my first doctor, his name was Ronaldo
I
Knape.
remember that.
Yeah,
Well,
yeah, I do, because he was type 1 diabetic too. He had type
all
1
right,
diabetes too.
all
So
right.
he knew what I was going through, so it was very helpful because we kind of spoke the same language.
Yeah, I get that.
He was kind of blunt because he needed to be to, like, to just wake us up, to wake all the family up. Look, this
Yeah,
is the reality. It's a hard reality. So do what you have to do. Otherwise, there will be consequences. That was it. But he was a very nice doctor, actually. He took care of me for uh, almost 15 years.
oh wow, okay.
Yeah. And, but I mean, as I said at the time, things were, um, he had less resources. Yeah. Um, the other doctor I had, was the experience was not good at all. Although I also was with him for 15 years, but the end was not nice because there was a certain situation, and he showed up. He was like, he was, I don't know. I would say not a good human being.
All right. Well, that
Yeah,
sounds.
because actually he made me go through some sort of. It was about being homophobic.
All right.
And yeah, yeah. And when he knew that I was gay, and he knew it when I got my my uh, my boyfriend at the time, who lived with me, I took him to the appointment because he had some questions to ask the doctor. And at the time, he studied some things, he read some things about, and he had some questions because, in a certain way, he took care of me when I had, like, um, hypoglycemic
Yeah.
crisis and stuff. So when he saw us together, and this boyfriend started asking him some questions, he felt really offended somehow. And he was like, "Oh, if you want to know medicine, really, you don't read these articles. You read a book like this." And he got this medicine book, like really
Yeah.
thick one, and threw it on the table.
What?
Like, and I was like, "What the hell is going on?"
Whoa.
And the next day, he called me and said that I was not his patient anymore.
You kidding?
I'm not. It seems
Wow.
I seem to be kidding,
Wow.
because when I hear myself telling the story, it's like, what was going on there?
This
Like,
is
I can't
really
believe it.
bad. Gosh, Angelo.
Yeah, yeah, yeah.
When
But
was
I
that?
mean,
How many years ago was that?
that was back in 2009.
So, well, that's quite a while ago. Okay, keep going. Sorry.
Yeah. But I mean, normally I had fantastic doctors. They're really nice. Uh, and nowadays I I go to this, what we call the diabetes center here at the hospital. It's called Hospital São Paulo Hospital, which is the hospital of the Federal University here in São Paulo. They have a diabetes center, which is directed by my doctor. Her name is Monica Gabay,
Mm-hmm.
and she is like the top specialist in Brazil in diabetes technology. And I go there because I use an insulin pump, and they know all about it. They know how to deal with the equipment. Actually, I know too, because we have to know a lot about the disease as a
Yeah,
patient. We have to really be informed. It
yeah,
can't be just about the doctor. We have to do our homework all the time. I have to
definitely.
study all the time.
Yeah, definitely. I completely hear you. This is also when I say, when I talk about the How to Speak Cancer book, this is something for the beginning, but advanced patients, they often know more than, like the GPs, because they just
Mhm.
get dig deep into the subject so much. Yeah. So I guess it's the same for you. And then you're young also, and maybe you like technique and you want to know all about it. So tell us, do you have that thingy on your arm, or how can we imagine your life now?
I do.
I guess
Would
you don't
you like me
pee
to
into
show it
bottles
to you?
anymore.
I can show it to you. Let me just
Yes,
take off my
please.
raincoat. It's been rainy here.
What the
So,
Brazil?
yeah, I mean, what's going on? I don't know about the weather anymore. It's crazy.
Oh, really?
So this is my sensor. The
Yeah.
sensor works with uh, this, which is my pump, my
Right.
insulin pump. It's a 780G Medtronic. It's one of the most modern systems in the world nowadays.
So here you
So
measure your
it's
blood.
easier.
So you have your blood sugar, and then that gets measured like a few times a day, or
Yeah, the
how does it?
sensor sends uh, the signal to the bomb to say how much my glucose level is every 5 minutes.
Wow.
And the pump, uh, with all the ratios and numbers that it has, because it's a little bit of mathematics as well there, and I have to know it, it decides, it has an algorithm. Yay, AI! I love it. Yeah, I mean,
So your pump is
uh,
thinking.
so it decides how much insulin I need the whole day. So it keeps sending little quantities of insulin to my body the whole day, which this is what we call basal insulin. We
Yeah.
need it
Yeah.
because our body works on insulin. We need, because insulin is what makes our glucose enter our cells, brain cells, any organ cells. And glucose is energy, and we need energy to survive, of course.
Yeah.
So insulin is fundamental. Yeah.
Yeah.
So it keeps sending insulin to my body all the time. But whenever I'm going to eat something, I have to inform the pump how much carbohydrates I'm ingesting. And then it will give me more insulin to cover that carbohydrate.
That is really interesting. And how do you inform your pump? Do you talk to it?
No, not yet. Oh, that's
It's
a good
coming. It's
idea.
coming.
That's a good idea. No, I just there's some buttons here that I click, and I just click the number, and
All
there it
right.
goes.
Yeah.
But
And is
I
that
have to do it 15 minutes before I can eat. So that's the lot of things that we have to control when we
yeah.
are type 1 diabetic. We have type 1 diabetes.
So it's not like when I sit here and I just go to the fridge and just have something. I have to know 15 minutes before that.
No, not at all.
I
Yes,
guess this can also
everything.
be a good thing.
Every, sorry.
This can also be a good thing, and then you don't eat all the time. Stress
Oh,
eating.
well, yes, yes. The thing is that one of the things that we most lose with type 1 diabetes is spontaneity.
Hmm. Yeah.
That's one of the biggest losses, because nothing in my life is spontaneous. What I mean by that, what do I mean by that? Is that, I mean, you you don't have it, so whatever you decide to eat, you just go there, you get it, and you eat it, and that's it. And your
Yeah.
pancreas is there working for you, not me. if I think of eating something, I have to see, oh, hold on, how much is my glucose level? So is it okay for me to eat it now? I want to eat some sweets now.
Yeah.
Fine. But if my glucose level is not okay, I can't. I'd better not, because it's going to go even higher.
Right.
Yeah. So I have to plan. So all the meals, everything that you're going to eat during the day has to be planned. You have to check with the glucose level first. You have to take insulin 15 minutes before. Uh, if you're traveling, you have traveling plans. You pack up, you get your tickets, you go to the airport, and that's it. Not for me. So I have to worry about, okay, all the things that I have to take for my insulin pump. Insulin infusion sets that I will change, sensors that I will change. This cannot go into my baggage. It has to be on my carry-on baggage.
Oh,
And then you have to go through customs. They will stop you to verify what that is. And you have an equipment in your body, so you cannot go through X-ray. So,
right.
so all of this is in your mind all the time. So you have to have the doctor's prescription to show them, look, I have type 1 diabetes. That's why this equipment is my insulin pump. What I have there on my carry-on luggage is things that I need for the pump. You have insulin. So everything has to be planned all the time. So you lose spontaneity in life, because
Yeah.
you have to think. I can't just decide and like, oh, I'm going to the gym now. No, it's not
This
like
was,
I'm going
I
to
was
the
just going to
gym
ask
now.
how it is with sports. Yes, you can't
Yeah,
go
it's
for a
not like,
run.
oh, I'm going to the gym now and that's it. No, check your glucose level. Is it okay? Okay. Based on your glucose level, always take with you, although you take insulin to maintain your glucose levels normal, and a normal target,
Range. Yeah.
uh, you tend sometimes to go very low. That's hypoglycemia. And this is very dangerous. It's life-threatening, actually. And you
Yeah.
have to act fast sometimes, because you may go unconscious and then just die,
Does your
basically.
pump give you a signal when you're going into too low sugar levels? Do you have like an alarm going on?
Yes, we have alarms going on, and it also cuts off the insulin that is sending to your body. If
Oh
it
yeah,
notices
yeah.
that it's going low,
That makes a
it
lot of sense.
stops. It stops the insulin, and it sees if it stops going low.
Yeah, right.
If it continues, then alarm comes on.
Very
Sometimes
smart technique.
during the night, twice.
Oh God. This is like having a little baby.
It is. It is. Well, before the pump, I used to do it all by myself. All this control, it would have to be by myself. And the nights were the most problematic, because we often worry, because you're sleeping. Sometimes you don't feel that you are going low.
Yeah, yeah.
And then it becomes dangerous, because from sleeping, you can just
Yeah, or
and not
slip
wake up anymore.
yeah. Or like slip into a
As I
coma. That's
haven't
pretty easy.
sometimes in my life.
Did you ever, yeah, did you experience that close to scenarios
Sorry?
yourself? Have you been at those scenarios? Like, did you experience that being so close to not waking up again, or could you always manage?
In 40 years, many times.
Oh gosh,
Yeah, yeah.
yeah.
You have to
Especially if you're
control it,
not,
but
yeah, in the beginning.
there are 42 factors affecting your glycemia.
Wow.
It's impossible to control all of that. So it's not only food. If it was, it would be easier.
Yeah.
But the weather affects your glycemia. your emotional side, anxiety, stress, whatever affects your glycemia. Any flu that you have affects your glycemia. Any other disease that you have affects your glycemia. 42 factors, so it's difficult for you to manage it all. You can
Yeah.
control some closely. Some others are like, so nocturnal hypoglycemia is dangerous because of that, because you just, from sleep, you go into passing out. And I woke up, like sometimes I woke up with the paramedic over my bed, over me
Oh God.
on the bed, trying to bring me back with glucose in my vein.
Wow. That is
That's how you
freaky.
bring
That's
somebody
very
like that
scary.
back. Yeah.
I noticed you have dogs. One dog or more dogs?
Three
Two,
dogs.
right? Are they trained? Are they diabetes trained?
No, they're not. I'm really amazed when I see those videos on Instagram with people who have dogs who are trained to,
Right?
they smell your hypoglycemia, and they're an alarm for you. Yeah.
That's
So it's
crazy, isn't it?
fantastic.
Because
It's
it could,
fantastic.
they really could help you when you sleep, you know. But now, I mean, you have your pump giving the alarm, which is such an amazing change in
Yeah.
how to work with type 1 diabetes. You're still very restricted and you're not spontaneous, but I guess it gives you a lot of time. Each and every single time you had to pee in the bottle, you had to wait for the thing, you had to like prepare the syringe and all this stuff. So this goes all automatically. At least I can imagine that this is a huge relief already. And this
Yes.
is all due to people joining like trials to try out this stuff, you know.
Isn't it amazing? Yeah. I think
Isn't that crazy?
doctors and scientists and participants in these clinical trials all the time,
Have you
because
ever?
in this 40 years I've seen so many advances
Yeah.
in type 1 diabetes, and I know it's because of these people that today I have this insulin pump here.
Yeah, serious.
And amazingly, the system is a very costly one. um, and I got to get it from the government, actually, here in São Paulo, via our system, our health system here in Brazil. And they approved my request, and they gave me the pump. And every month, they give me all the things that I need to maintain the pump: insulin, infusion sets, sensors.
But that leads me to one of my last questions. This healthcare system in Brazil, how can we imagine that? Is everyone insured and gets all the pills for free and all the stuff you need, the doctor's appointments, or do you pay for everything individually? And now you said you get it from the government. Is that kind of like a health insurance, or how can
Yes,
you tell it?
it's a health system. So with public hospitals and everything that you need, doctors and exams, tests, surgeries for every different area, oncological area, including the oncological area, diabetes, whatnot. And well, it works fine. It could work much better, of course. Brazil is a very big, complex country with many different realities, regional realities, which are totally different. I live in the southeast of Brazil, which is like, I would say, the easiest area for you to live in.
Basic.
But we have regions like the North region, some parts of the Northeast region, which are not covered as we are here, which is so unfortunate. Anyway, but this system, this health system is national. So it is bureaucratic because it has to cover so many instances, so many different places, so many different people. So we kind of have to struggle through bureaucracy somehow, which is kind of understandable. It could be better once again. And I do hope that Brazilians recognize it and we fight for it to be better, because it is the system that really, it's because of the system that we can be supported when we go through difficult moments, you know. If we have to resort to the private sector, which is very good here in Brazil, but very costly too.
Yeah.
So if you don't have the money to pay for that, you have at least some hope in the public sector.
So the public sector is kind of like paid through taxes, I guess.
Yes.
Yeah. And then you can buy on top if you have a better paying job. You could buy on top extra services.
Yes.
Yes.
You could do it personally. People also often receive it at work. So companies who give you healthcare plans, but you could do it privately as well.
Yeah.
Personally.
Well, thank you. That gives me a much better picture of how you live through this and with this. One last question, 3 advices for people who are listening, who want to probably prevent type 2 diabetes. What would you think? What is more, because the ones who are having type 1 diabetes, I guess they are the experts. But type 2 is another disease that is very often talked about. I thought maybe you have some advice. If you could tell them something, what would you say?
Sure. Yes, type 2 diabetes, you have to be concerned, and it's about it's a whole life process. It's all through your life to worry about what you ingest, what you eat, in terms of quantity, in terms of quality. The more you eat real food, the better. So the more you eat vegetables, legumes, whatever you find in nature, it's better than just opening up a pack or a package, you know. The usual stuff. I mean, that doctors normally tell us. I mean, exercising. Exercising is fundamental. And once again, this is not about a part of your time. It should be in your routine, which makes it much more difficult.
Yeah.
This has to be absorbed into our routine. So worrying about what we eat, including exercise in our lives. So exercising the body would be fundamental.
It's a bit like going back in time, right?
Yes, absolutely.
I heard about the grandmother's diet once, and I was like, yes, this sounds so healthy. Eat what grows in your country and what would grow in your garden, and then get it yourself. Then you have the exercise, you know, you don't have to go into the gym if you have a farm or a garden or anything. So yeah, just kind of find back to your roots, I would say. And then that actually counts for a lot of conditions we have these days, you know, like hypertension, heart attacks, all the hypercholesterol and all this stuff. So yes, well, Angelo, thank you so much for today that you took the time to wake up early. It was a pleasure to talk to you. And I'm going to see you in the next MedTalk, I think.
Thank you, Catherine. It's been a pleasure. It's been
You.
a pleasure talking about type 1 diabetes and maybe trying to inform people more about it. As I said, we're often confused with type 2. There are different diseases. They have different treatments, different realities, actually. So it's important to inform people. So I hope this can reach people who need the information there. So it's been really a pleasure. I have much more to say, actually. So let's do a second one.
Well, let's talk again. I would say we hit the hour, and I think our listeners need to digest everything you said, and it's gonna be rich. People will definitely have learned a lot. Annabella already wrote in the chat that she couldn't stop listening, and it's very interesting, fascinating for people who don't know about it,
Thank you for being here, Annabella.
Especially the difference between 1 and 2. I think it's very important that we highlight that. And I will do that in the upcoming post when we post the recording. And for now, I want you to have the best day possible because it's very early still. And I hope it doesn't rain anymore. I'll see you next time.
Thank you, everyone. Bye-bye.